How to spot a schizophrenia relapse. Schizophrenia relapses can be very dangerous. The more relapses you have, the more likely another will occur. A relapse is when you experience psychotic symptoms that have been treated and managed previously. You can spot a schizophrenia relapse by recognizing early warning signs, identifying risk factors, and working to prevent a relapse. Method 1: Recognizing warning signs of a relapse. 1. Notice if you start having delusions. One common sign of a schizophrenia relapse is having delusions. These delusions may take different forms. You may start hearing voices inside your head, seeing things that aren't there, believing things that aren't true, or being paranoid. You may find yourself suspicious of friends or loved ones, so you may stop being around them or stay away from them. 2. Check for social withdrawal. Withdrawing from your friends and family is one of the early warning signs of a schizophrenia relapse. You may stop calling or texting them, or you may start canceling plans. You may decide that you don't want to be around anyone, and instead spend all your time alone. You may not want to be around people because you are suspicious of them or feel angry towards them. This is also an early warning sign. 3. Watch for mood changes. Another symptom of schizophrenia relapse is the sudden negative change in your mood or emotions. You may suddenly start being irritable, annoyed, or irrationally angry. You may also find yourself more anxious, sad, or depressed. You may feel more agitated or lose your temper more easily. You may start acting or feeling more nervous than usual. You may start talking in a more aggressive or depressed way. 4. Look for sleep disruptions. If you are in danger of a relapse, you may experience sleep disruptions. This means that you may stop sleeping due to insomnia, or you may not feel like need sleep for one or more nights. You may be unable to fall asleep because you feel restless, have racing thoughts, hear voices, or are suffering from paranoia. 5. Monitor for disorganized thinking. Another symptom for a schizophrenia relapse is disorganized thinking. This may lead to confusion, racing thoughts, thoughts that won't go away or leave you alone, or thinking that may not be connected. This may make it hard to concentrate or complete daily tasks. This disordered thinking may lead to strange thoughts or untrue thoughts. 6. Check for other behavior changes. If you are in danger of a relapse, you may experience additional behavior changes. Your appetite may change and you may start eating less or not wanting to eat at all. You may have less energy and feel extremely lethargic, or you may suddenly start acting with more energy. You may notice that you stop caring about the way you look and let your personal hygiene go. Ask yourself, have I taken a shower or bathed recently? You may stop being interested in things that you used to be interested in. Method 2: Identifying risks for a schizophrenia relapse. 1. Admit if you've stopped taking your medication. The most common reason for a schizophrenia relapse is stopping to take your medication. Many people stop taking their medication because they feel like they don't need the medication any longer because the symptoms have gone away. Others may stop if they experience negative side effects. Don't stop taking your medication without talking to your doctor first. Often, a schizophrenia relapse can be prevented by continuing to take your medication. Ask yourself if you have taken your medication in the correct dosage each day. If you have missed doses, you may need to talk to your doctor. 2. Determine if you have been abusing alcohol or drugs. Substance abuse is another common cause for schizophrenia relapse. If you have been drinking alcohol or taking recreational drugs, you are at a risk for a relapse. These substances can trigger psychotic symptoms and episodes. Try to eliminate all drugs and alcohol from your life. This includes tobacco and even caffeine. 3. Decide if you are under stress. Unnecessary stress and emotional upsets can trigger a relapse. You may feel stress from one or more parts of your life, like work, family, or relationships. The stress can lead to anxiety, lethargy, and social withdrawal, all of which are early warning signs for a relapse. You may be triggered into a relapse by a fight with someone close to you, problems at work, or drastic life changes that are positive or negative. Method 3: Preventing relapses. 1. Stick to your treatment. One of the best ways to prevent a schizophrenia relapse from occurring is to stick to your treatment. This includes taking your medicine as prescribed, even if you are experiencing no symptoms. You should also go to all therapy appointments and keep up with any psychotherapy treatment. If your symptoms are better, you may want to discuss what the lowest dose of your medication is with your doctor. You shouldn't stop therapy even if you are managing your schizophrenia. Discuss reducing your therapy sessions with your therapist. 2. Join a support group. A support group is a great self-management technique you can use to help prevent relapses. Support groups are informal gatherings run by others who also suffer from schizophrenia. Support groups offer you support and understanding, along with a place to be honest about your feelings and experiences. Support groups can help you figure out ways to manage your schizophrenia or approach problems. You can ask questions and speak with others who have gone through what you have. 3. Learn the early signs of a relapse. Knowing how to spot the early signs of a relapse can help you do something before the relapse takes hold. The relapse symptoms let you know that something is wrong before you go into a psychotic episode. You can monitor yourself or get help from a trusted family member or friend. You may want to turn the relapse symptoms into a self-assessment checklist. Every day or every few days, you can read through the questions to help determine if you are experiencing early warning signs. For example, you may ask yourself if you have been experiencing insomnia, social withdrawal, a lack of interest in hygiene, anxiety or depression, problems in concentration, or forgetfulness. 4. See your doctor. If you think you are experiencing or are in danger of experiencing a relapse, you should go see your doctor immediately. Tell your doctor about your symptoms. Be honest about any specific risk factors, such as forgetting medication, taking drugs, or being under stress. Talk to your friends or family members about what to do in case of a relapse. They may have to take you to the doctor or help get you hospitalization.